Hello everyone, this is my presentation and my name is Hannah Stowers for those of you who don't know me. I chose outpatient services as my research project. I chose this because I feel that outpatient services are a huge part to our healthcare system that is frequently overlooked, or people don't know how broad that outpatient services are. Alright, so we'll go on to the next. What is outpatient services? It also can be classified as ambulatory care. This is frequently used either way. You can use it, it's an interchangeable word. The definition for outpatient care is what is made up of medical procedures, tests, and services that can be provided to the patient in a setting that does not involve an overnight hospital stay. And go on to the next. Next, we're going to talk about the history of outpatient services, and it begins all the way back into the early 1900s, where physicians would either work in their privately owned offices, which is generally in their homes, or they'd usually travel from patient to patient with via horse and buggy, and which is crazy to think about because I mean it would take a long time for them to travel, which would make them have minimal patients because of the amount they would have to travel from house to house, because they all didn't live in a neighborhood like we do now. Then also in the early 1900s, the number of hospitals grew quickly, and then at a time that as sanitation increased and hospital infections decreased and antiseptic surgery began to be practiced. And then by 1916, there was 495 hospitals had opened and ambulatory outpatient clinics. So then during the 1980s, the image of outpatient clinics is being known as the stepchild disappeared. And this goes back to in the early 1900s, they were classified as a stepchild because people thought that hospitals were more important than outpatient services, so it was known as the stepchild. And then by the 1980s, that's when it finally disappeared. Alright, and some little bit more history about outpatient services is in the 1980 outpatient clinics earnings of approximately 13% of total hospital revenues. And then this increased dramatically throughout the decade of the 1990s up to 35.2% of the total hospital revenues. And then it has expanded from general practice clinic to specialized clinics during this time. What types of outpatient services are offered today? There's a very wide variety, as you can see by this list. It goes for anything from wellness and prevention services such as counseling and weight loss programs, and diagnostic services such as lab tests, x-rays, MRIs, ultrasound, treatments such as some surgeries and chemotherapy can be in an out-service clinic to where you don't have to be hospitalized for that. Rehabilitation such as physical therapy, primary care physicians, of course, community health clinics, urgent care clinics, specialized outpatient clinics, pharmacies, and even emergency departments. That one's frequently missed because they think that you do have to be hospitalized for emergency department, but they do hospitalize patients sometimes, but most of the time they're treated and then they are released. They're not hospitalized overnight. Now I'm going to talk about a couple of in-depth about the outpatient services. I'm not going to talk about all of them because it would be a lot, and that would be too many minutes. The first one I'm going to talk about is primary care providers. Primary care clinics are where patients go to be seen by their primary care physicians, known as their PCPs, is the acronym that people use. The PCP often is used as a gatekeeper and coordinator of directing patients to other more specialized medical when needed. And we've talked about this in class before with primary care providers. A gatekeeper basically is when they, like I said, coordinate the care, but they send you to where you need to go. So they do the workup of everything, so that when you go somewhere else, they do another workup of everything. For like an example, if you go somewhere and have an x-ray done, then you go to another place and you have another x-ray done, because they like to have their own images. But if your primary care provider does it and then sends you to where you need to be sent to, that would help reduce radiation and healthcare costs. And gatekeeping is another big thing that healthcare, I think, has steered away from for the most part, but it still is frequently used today. Some examples of PCPs are family medicine doctors, pediatricians, internists, and other, sometimes even OBGYNs. And the next one we're going to talk about is an urgent care center. An urgent care center is an outpatient clinic that provides medical services for patients who need immediate treatment for illness and injuries that cannot wait a day or two to see their primary care provider. But their injury is not life-threatening or dangerous enough to demand a trip to the ER. These centers work by taking some of the burden off ERs by relieving them of less emergent patient problems, and by allowing patients to receive care in a timely and convenient way. Examples of this are MedExpress or the Minute Clinic. And I think urgent care centers are another big part that's important in the healthcare system, because, I mean, if the emergency department does get bogged down with just a bunch of people that have strep or even the flu, when someone in a urgent care center can effectively treat the patient for that, and then most of the times this is just a step before, then they will end up telling them to follow up with their primary care provider just to make sure that they did get treated fully and that their illness did dissipate. The next one is surgical procedures that are considered as outpatient surgery. I think it's crazy to think that there are surgeries that are considered outpatient surgeries, because most places that you go, you have to be put under anesthesia, and that requires a lot of monitoring. And so to know that you don't have to stay overnight for something like that is a big step. So there are many surgical procedures that are considered outpatient care as long as the patient leaves the facility the same day. And there's many surgical centers that provide same-day treatment for less involved or less invasive procedures. Some examples of these are minor orthopedic surgeries, and examples of those are carpal tunnel release or ACL reconstruction, and even rotator cuff repairs. And I just want to talk a little bit about orthopedic procedures, because they have come a long way, especially in our area. Now the average stay for total knees and hips at Princeton Hospital is 1.5 days, and it does give or take the amount, and this is from patients being with them improving anesthesia and even pain control. And they have now, they even all over the world, they want to make total joint replacements. They want to make that to just a day surgery, but that will take a lot. But it has become a lot more than what it is now. And certain cardiac procedures, this is like pacemaker implantations and cardiac MRIs and wisdom teeth extraction and even tonsil removal. All right, and the next thing I want to talk about is just my journal articles that I had in my research paper. And the first one that I chose was about reducing wait time in outpatient services by combining triage with initial management. And I think a big thing in healthcare is that patients tend to see a long wait time wherever they go, and this tends to make them agitated because they are in pain and they do want something fast, and we just live in a fast-paced world where everybody has access at their fingertips to things, to where they can be readily accessible to a lot of things. And so when something like this happens, that they can't easily access like something that they need, they tend to get agitated, and long wait times is a big factor. With this article, they used a stepped wedge cluster randomized control trial, and then the results of this were, it went from 19 to 86 minutes down to the median being 13 to 48 minutes, which the first number didn't decrease drastically, but the second number did. So if someone compared to waiting 86 minutes to 48 minutes is a big increase and would help the patient not be as agitated. And my second journal article also was about reducing wait time, but it was in a primary care facility. They used two strategic approaches. The first was to increase hospital capacity, and so they achieved faster throughput of patients. The second was to reduce the demand for specialist care by finding alternatives to outpatient treatment. So that would basically be with like helping, going back to the gatekeeping. Continued with the article, my second journal article, there's 4 models that they reviewed. The first one was the transfer model, and this was the substitution of services delivered by hospital clinicians for services delivered by primary care clinicians. This included minor surgeries, diabetes care, and discharge from outpatient follow-up. The second one was relocation, which was the shifting of the venue of the specialist care from outpatient clinics to primary care without changing the people who deliver the service. This included shifted outpatient clinics, telemedicine, and attachment of specialists to primary care teams. The third one was the liaison, which is the joint working between specialists and primary care practitioners to provide care to individual patients. This included shared care and consultation liaison. Professional behavior change was the interventions intended to change the referral behavior of primary care practitioners, including referral guidelines, audit and feedback, and educational financial incentives. And still with the second article, the results were on what improved for the wait times, and this was what improved once they did this was the discharge of outpatients to no follow-up, the patient initiated the follow-up, and the general practice follow-up as alternatives to routine follow-up in the hospital outpatient clinic. And then my last article is about the demand for hospital outpatient services. They had two objectives, and the first one was to identify the factors which influence demand for these services. And then the second one was to determine the relationship between outpatient service volume and the availability and price of alternative sources of care. Particularly office-based physicians and outpatient services with 385 hospital inpatient services. The results were that they increased the demand of based off of insurance, especially with Blue Cross Blue Shield, because it provided better coverage for outpatient services for the insurance holders who had the people who had that insurance. But overall, it did increase the demand of outpatient services because it is a huge part of healthcare. But mainly this one was, they did see a increase with just based off of one certain kind of insurance. And these are my references. And any questions?